Okay. So, next question is about root canals. People have a lot of questions about root canals, so let me just throw a few of them out there and then you
Okay.
can answer. One is people will call and ask, they'll say that another dentist recommended that they need a root canal, so they want to see if there's any therapy that we can do to possibly prevent them from having to have a root canal. Other patients will call just to see if we do root canals because a dentist told them they need one and they think that, they would like to come to our practice to have it done. And then we also have other patients who call because they have a root canal and they're not wanting it in their mouth anymore and they want to know, what we can offer to help them.
Well, I'll just give you some insight on how we, work with root canals. There was once upon a time where we didn't have dental implants, so if a patient wanted to keep their tooth in their mouth and they had a deep cavity, their options very quickly became either do a root canal or extract the tooth. So if this is an important tooth to the patient, like maybe one of their front teeth or one of their important molars, they we're having these teeth root canal treated, and now a lot of our patients will have a lot of root canals that are in their mouth. The question is, should we take them out? Are they infected? Are they not infected? The material that's in the roots of these people's teeth is definitely a foreign material, like filler materials and other materials. So, we can test to see if they're sensitive towards the material, to see if it's a bother to their immune system. We can take x-rays and try to determine if there's any infection. If there's any infection, that would require immediate treatment if we knew about that. I'm
Is there any way to, if somebody was recommended by another dentist to have a root canal done, is there anything that we can do to work on that tooth to possibly prevent that from having to be the treatment?
Oh, definitely. Yeah, definitely. I can't tell you how many times I've had people come into the office that have been advised to have a root canal where we were able to do some therapies to avoid them needing a root canal.
What therapies?
Well, it depends on, well, first we'll take a look at the tooth to see if the tooth, in fact, does need a root canal. Normally you'll have a tooth that's symptomatic and sore, so the first question is, well, what is the symptom and what is causing it? I've seen cases where people have just a tooth that's heavy in their bite, like they have a really heavy bite, and I've gone in there and adjusted the bite and given them an ozone injection, which can greatly reduce the inflammation in the area, and that's been enough to reverse the inflammation inside the tooth and cause them not to need a root canal. A root canal becomes necessary when the insult or the problem associated with the tooth has gotten to the point where the tooth is so severely inflamed that the nerve is dying, or worse yet, the nerve may already be dead. If the nerve's already dead in the tooth, then there's nothing we can do. It's dead, and they gotta deal with the root canal or take that tooth out.
Do you do root canal procedures in your office?
No, we don't. We actually do not do root canals in the office. We will discuss the pros and cons of doing the root canals with the patient, and we do have some patients who will still opt to have root canals done, and they can go see an endodontist and have that done. And most teeth that have root canals will need crowns, so we'll put a crown on top of it, and we'll keep an eye on the root canal. But no, we don't do root canals in the office. I think that there's a lot of reasons. They cost a lot of money, and sometimes they don't work out for the patient. And there are medical concerns associated with doing it. So we just made a decision in the office that we're going to have those treatments not done, and what the patients wanted them to have them done by a specialist.